The government is buying in bulk before trial results are complete. 100 million doses from the Oxford project made by AstraZeneca. 60 million from a French company, Valneva, using an established method but whose human trials haven't yet started. And another 30 million from a German and US partnership, BioNTech and Pfizer, already scaling up production before they know it works.
What we're doing here is essentially the clinical trial work, and alongside that, the manufacturing, so that we know that we're able to go from a thimbleful of the vaccine to multiple doses.
Scientists are condensing the work of decades into months. Years of research, and still there's no vaccine on the market for AIDS, and pilot projects only began for malaria and for Ebola last year. 9 in 10 fail, and none might offer a complete solution. John Ray, ITV News.
If there is one document you should read this year, it's this one. Changes to human medicine regulations to support the rollout of COVID vaccines. This was published on the 28th of August, 2020. What was a conspiracy theory only a few months ago is now here in an official government publication, and it's time to take precise action and stop this proposal. I'll tell you exactly how to do this at the end of this video.
I can announce today that the government has set up a vaccines task force to coordinate the efforts of government, academia and industry towards a single goal: to accelerate the development of a coronavirus vaccine.
The UK government is seeking to make changes to the human medicine regulations. These changes will support the rollout of a COVID-19 vaccine programme in the UK. I will only state facts out of the document, so this video doesn't get fast-checked and censored. People need to see this so they know what is coming. There are 5 points in this document. I urge you to read it for yourselves and think of the subtext as well. Request for temporary authorization of the supply of unlicensed products. This means unlicensed vaccines will be allowed as long as the manufacturer can demonstrate safety and efficiency. Civil liability and immunity. In simple terms, if the vaccine causes injury or death, the manufacturer cannot be sued. The government's argument is this, and I quote, "If manufacturers are asked to supply an unlicensed medicine in response to a public health threat, it is unfair to ask them to take responsibility for the consequences of the use of that medicine." Proposed expansion to the workforce eligible to administer vaccinations. Currently, only qualified health professionals can administer prescription drug injections. This law will mean people other than health professionals can administer the injections. This includes local authorities, and to add to that, these people will also be immune from any civil liability. Vaccine promotion. In the UK, there is a prohibition on promoting an unlicensed medicine to the public. The UK government is proposing that this prohibition is disabled to allow advertising the COVID-19 vaccine to the public. Make short-term provisions for the wholesale dealing of COVID-19 vaccines. This is for the entities that do not hold a wholesale license, such as the NHS and the armed forces. This law will allow the movement of the vaccine in the supply chain. If you read the full proposal, you will think it is written by the pharmaceutical companies, not the government. Everything I mentioned so far has been directly from the proposal. If you take no issue with any of these changes, then you can stop watching now. But if you realise what this could mean and how it fits within their larger plans, then it's time to act. They have kindly given the public the chance to comment on this proposal with a tight deadline of the 18th of September 2020, which gives under 21 days to submit comments. Let's put our voices together and submit a document signed by as many people as possible. We've added a page on our website where you can submit your comments. We will gather it all and submit, along with a petition to Parliament for maximum impact. Meanwhile, research the connections between pharmaceutical corporations and the politicians, and this document will make even more sense. Watch the episode Digital Dictators for more information on this topic. They distract you with scaremongering propaganda, dividing us by race and class, while they sneak these laws through, becoming the foundation of our enslavement. Britain seems to be spearheading this campaign, and whatever gets implemented here affects the rest of the world. So if you are not in the UK, keep an eye out for what laws are being passed. It's time we pay attention to their every move, study it collectively, and challenge these changes to the law under the pandemic umbrella. We are being robbed of our lives, our dignity, and if we do not act now, these laws continue to pass. When was the last time that you heard of a law passed during a crisis and was then cancelled after the crisis came to an end? Now you can't say that you did not know what is coming. Remember, we are not outnumbered. We are just unorganised. I want you to take a note of this important date, the 26th of September 2020. On that day, the Coronavirus Act 2020 will be in place for 6 months, which means it has to be reviewed in the House of Commons for 7 days.
Coronavirus Bill, second reading.
Mr. Speaker, coronavirus is the most serious public health emergency that has faced the world in a century. And to defeat it, we are proposing extraordinary measures of the kind never seen before in peacetime. Crucially, the legislation is time limited for 2 years, and the measures can each be switched on and off individually as necessary.
Could the timing of the recent increased testing be to drive the numbers up close to the 6-month review date in order to have an excuse to extend the Coronavirus Act further? If you feel that this act needs to be stopped, write to your local Member of Parliament. We have template letters on our website. Also sign the petition and share it widely. You have no idea how bad the censorship is right now, so we all need to work much harder at sharing information. We need at least 100,000 signatures for this to be discussed at Parliament. Let's send them a very clear message.
Health Passport Ireland is created to protect our society and our economy. Built in Ireland by the RockU Group, the system uses the very best COVID-19 testing, combined with the latest mobile technologies. Health Passport Ireland is powered by proven and validated systems, allowing us all to take safer steps in our return to our normal way of life. Here's how it works. With Health Passport Ireland, everyone can now be tested for COVID-19 at any time, which helps to protect you, your family, our jobs, and our economy. Your COVID-19 test will be performed with highly accurate serological or swab tests. Your test is performed by a medical professional. After your COVID-19 test, an authorised healthcare administrator creates your Health Passport Ireland account. Your login details will be emailed to you immediately with a link to download your Health Passport mobile app. The authorised healthcare administrator securely updates your COVID-19 test results in your Health Passport. Once activated, you can easily display your COVID-19 status on your mobile. Your Health Passport can be scanned if you wish, which helps protect those around us. Your COVID-19 status will efficiently display as green, amber or red, dependent on your test results. This allows us to go about our daily activities in a safer way. We can all use Health Passport Ireland in many ways, such as travel, hospitality, education, healthcare, construction, offices, entertainment, visits, and much, much more. Naturally, the validity of your COVID-19 test will expire over time, so an automatic reminder will be sent when it's time to be tested again. Your status will move to amber when your test period has expired. Health Passport Ireland does not use Bluetooth or track your location. This preserves your privacy. The systems can work in harmony with existing government contact tracing apps. When a vaccine becomes available, your official vaccination status can also be displayed within your health passport. You can even keep a diary of your international travel and events you have attended. Health Passport Ireland can be linked to existing secure medical systems if required, for example, at your GP or hospital. You can visit www.healthpassportireland.ie for more information. Health Passport.